Do you cough? Guess what? I do too. Are you a right cough pocket or a left cough pocket? We are here, Poplar Community, and we are talking about prioritizing bronchial hygiene this month. And bronchial hygiene really means mucus clearance and cough. And it is our lungs' natural defense mechanism. So our lungs is one of the very few organs that is open to its environment. So it needs a defense mechanism. If we get irritants, debris, allergens, things in our lungs that we don't want, we need to be able to capture it and get it out. And our body has a way to do that. Interestingly, also called pulmonary toilet. Always wanted to know who came up with that one. But the way that we get rid of it through mucus clearance and cough, do check out Tina's video on prioritizing mucus clearance. She's got some great tips, including managing upper airway mucus versus lower airway mucus, so go check that out. In this video though, we're going to focus on the cough mechanism, the cough reflex. And that's exactly what it is. We don't have to think about how to cough. Our body knows how to do it. So we have receptors for cough in our airways. So we have it in our trachea. We have it where our airways kind of branch off into two main branches here, our bronchi, right in the center there in the carina. We have receptors in the back of our throat. We have receptors in our ear canals, in our sinuses, in our diaphragm or big respiratory muscle, in the stomach as well, and around the heart. So our body is primed to sense irritants that we don't want in our lungs and to cough it out. And the way that that happens is that once these receptors sense a disturbance or an invader that we don't want in our airways, it gets collected in the mucus, and we naturally have mucus in our airways. It traps those irritants, debris, and then the little hair-like structure cilia kind of move that up to about right here where we can cough it out. And what happens is signals go up to our brain, and our brain sends signals back down for us to take a really big breath in with closed vocal cords. So we're really creating a lot of pressure in our chest, and when we open up our vocal cords and release that air very quickly, that's the cough. All that stuff we don't want in our airways can come out. And did you know that in a healthy individual, an effective cough can be as fast as 500 miles per hour? Crazy. Our bodies are amazing. So why is cough so problematic? And it really can be. There is an emotional and a mental toll to cough. Sometimes we cough and we don't know the reason. Sometimes we cough and it's very chronic or persistent. And sometimes that cough really wreaks havoc on our quality of life, maybe waking us up at night, or uncontrolled coughs that sometimes have us dizzy or lightheaded or short of breath. And so my tip number one for you with cough is to notice when you cough, because it is a sign that something's up in your body and you should get assessed. So cough really is, especially if it's persistent or chronic, really symptomatic of something. So do see your healthcare providers. It could be something that's sort of acute, like a common cold or flu, a pneumonia, but it could also be related to the heart, either coughing because of a heart condition or medications that we're on for blood pressure, for example. Cough can be related to our lungs, of course. We have receptors way down in those small airways of the lungs, and when they experience changes like airway narrowing or closing, that can make us cough. And so maybe that's leading us down perhaps with a chronic lung condition, either being diagnosed with a chronic lung condition or the chronic lung condition that you have is just uncontrolled right now or progressing. So tip number one, if you have a cough, it is our body's natural defense mechanism, but if it's persistent, do get it checked out by a healthcare professional. All right, tip number two when it comes to cough. So my tip for you is to try not to hold in your cough. It's amazing how we kind of just have that natural response sometimes. And for me, it really got brought to my attention with my daughter, who's 7, and whenever she would have an infection of some sort, and I'd hear her really rattly, especially in the morning, and I'm kind of expecting her to cough, and she's not coughing, and I would have to coach her to cough out the things in our lungs. So again, remember that defense mechanism. Our body wants to cough to get rid of things in our lungs, especially mucus that might have trapped bacteria, viruses, things we want to get out. So I would have to coach her to take a big breath in and to do a deep cough to kind of work stuff out of her lungs. And so it got me thinking about that a little bit. And you know, coughing does get a bad rap these days ever since the COVID-19 pandemic. It can be socially unacceptable. There's a stigma with coughing. So just be kind to yourself and be kind to others around you. Cough if you need to. Use your cough pockets or cough into a tissue. And let people know that, you know, hey, I've got a chronic lung condition, I cough, and that's just part of my lung condition. And let's just advocate for others that need that and use kindness. But one tip that I do have for you relates to effective cough strategies or huff coughing or controlled coughing. And so for some of you living with chronic lung conditions, you might have heard of this before. It might have even been prescribed to you, maybe even to use a particular device to help get mucus out. And so I just wanted to highlight, sometimes doing a regular cough habit in the morning or in the evening can really be helpful to get that cough under control. Because remember, you're coughing to get those things out of your lungs. And if we make it part of our everyday rhythm, part of our treatment strategy, especially those of you who do produce excess mucus because of your chronic lung condition, it can really, really help. And so it might take a little extra time, maybe 10 to 20 minutes in the morning, maybe a combination of your inhalers, some pursed lip breathing, some deeper breathing, and then some controlled coughing techniques like the huff cough or the controlled cough. So do check out some of our other videos because we do go into that a little bit. So tip number one, cough. Absolutely do it, cough in freedom. Tip number two, don't hold in the cough. Do have a cough rhythm to your day or incorporate coughing strategies in the morning or evening of your day. And don't feel afraid to go out there and do the things that you love to do. Use kindness and let people know what you need, and that maybe you're living with a lung condition and that cough is just a part of that. All right, tip number 3. So tip number 3, we are not going to be able to dive into this rather large toolbox of treatments for cough because it all depends on what the underlying condition is that is maybe causing a more persistent or chronic cough. You know, sometimes you might be working with your healthcare professionals and you might be eliminating, it's not this, it's not this, it's not this, and you might end up at the end of the day with an unexplained cough. So get informed as much as you can, research as much as you can, talk to your healthcare team as much as you can. Come talk to us at Poplar Pulmonary Wellness. Our CREs are there to help you, our respiratory therapists and certified respiratory educators. I do want to just slowly pick out a couple things from the toolbox just to touch on. So number one, kind of more preventative approach to cough would be to quit smoking. So smoke is definitely an irritant for our airways. It can definitely make you cough. And I read this fantastic statistic that those who are smoking and then quit, 90% of them notice that the cough goes away. Amazing. That is a huge number. Quitting smoking is absolutely one of the number one best things you could do for your health. Not easy, we know, but do come talk to us or seek help in your local community for quitting smoking. Another tool in our toolbox that we get questions about is over-the-counter medications, things like antihistamines, decongestants, cough suppressants, expectorants, which are those medications that thin out mucus to make it easier to cough out and clear. So remember, it may be okay to use these things with something acute, like a cold or flu. You know, if you need some extra treatment to help you sleep at night, it is a little bit of a balance, but remember, these are not long-term treatments. So do talk to your healthcare providers and get to the bottom of a persistent chronic cough. These can be used in the short term over-the-counter medications. Another tool in the toolbox, and this is the last tool I'll bring up for this video, might be inhalers. And we have two kinds, and the one I'd like to talk about is our quick-acting bronchodilator or reliever inhaler. And those of you who have been diagnosed with a chronic lung condition, particularly an airway condition like asthma or COPD, maybe you've been prescribed one of these to use in an emergency or when you're having breakthrough symptoms. And I'd just like to highlight that one of those symptoms can be uncontrolled cough. So sometimes we think of using this puffer when we're feeling short of breath, and we might not always think of using it when we have cough. And that uncontrolled cough where it feels kind of really hard to come out of that cycle. But this absolutely might help in those situations. So keep it handy, use it as prescribed. You can use it on an as-needed basis, and one of those symptoms can be cough and trying to stop that cycle of uncontrolled cough, which is very uncomfortable. One added point for reliever medications, which is so important, is those of you with asthma or asthma COPD overlap, anything where your doctor's prescribed a reliever together with an anti-inflammatory, be sure to use that puffer as your quick-acting reliever in moments of distress with a persistent chronic cough, and again in that cycle that's hard to break. You can use the blue puffer if you've been prescribed that, but if you have an inflammation component to your airways issue like asthma or asthma COPD, use your quick acting reliever that also has the anti-inflammatory in it. So I hope those 3 tips are helpful. So persistent chronic cough is symptomatic of something. Do get it checked out. Feel free to cough in freedom. Cough is our natural defense mechanism. Get that stuff out of your lungs. And we do have a toolbox of cough strategies, treatment options. So come to us here at Poplar Pulmonary Wellness, book your free welcome session, sit down with a respiratory therapist, certified respiratory educator, and let's work together to get to the bottom of your cough. So we hope you get out there and live your best lung life. We'll see you next time.